Actually, it's kind of fun. I cover that in my talk about myths about heart disease. I'm a runner, therefore I can't have a heart attack. Total myth. 300,000 sudden cardiac deaths a year, 100,000 are athletes. What's going on? Exercise is not the total answer. So let me see how well I can explain this. First of all, you have to understand what happens in a heart attack. And it's not that cholesterol plaque builds up on the wall and it slowly squeezes off over time. That's not it. In a heart attack, yes, there may be a plaque. It may not even be very big, but if that plaque ruptures or explodes, it breaks open because there's a little cap over it. If that cap disappears, that cholesterol goo gets into the bloodstream and a clot happens just like that. I mean, it's just that fast. Plaque rupture, and there's this clot, and that causes the lack of blood flow. That's a heart attack, okay? If it happens in such a way that the rhythm is messed up in the heart, you may have an abnormal rhythm, and that person will drop to the ground and die if they don't get medical help immediately. So that's what's happening. So now it may make a little more sense. Being a runner does not protect you, okay? We all have plaque. I don't care how pure your lifestyle is or how young you are. Atherosclerosis is well established in people in their late teens. We can find fatty streaks in the blood vessels of children, okay? It's already started. So what you have to understand, though, is that plaque does not have to be very big in order to rupture and cause death. And when you realize that, hey, they've got a plaque, it's just ruptured, and they died, there's your answer. We know that athletes are less likely to die of heart attack sort of compared to the general population for most of the time. But while they are exercising and immediately after, their risk is much, much higher. So that's kind of the answer to that question. Now, this is another exciting thing about nitric oxide. Guess what it does? It stabilizes that cap over the plaque so that it's less likely to rupture. You may hear me say, somebody famous dies of sudden cardiac death like this again, and I'll say, it didn't have to happen. More nitric oxide in the system, and that person might have been protected. So, Doc, where do I buy this nitric oxide pill? Well, you don't. You can't. It doesn't come that way. But what you can do is give your body what it needs to make it and let your body work the miracle. And what your body needs to make it is arginine, preferably together with citrulline. Just to explain, arginine is an amino acid. You find some in your foods, but there's not nearly enough for most of us to have this miracle, going on inside of us. Most of us are going to need to take supplements by itself. Plus, when you get it in food, there's other amino acids. The messenger is garbled to me. You want a pure arginine and citrulline together. Arginine is going to get in your body, and the lining of your blood vessels will turn that into nitric oxide. Will it turn it into nitric oxide in your fingers? Yes. In your heart? Yes. In your brain? Yes. In your feet? Yes. All over your body, all of your blood vessels have this lining, and they will turn it into nitric oxide. That's how you get it. Citrulline sort of makes it a long-acting effect because your body turns citrulline into arginine. Arginine itself is going to go away pretty quickly, okay? 1 to 3 hours, we know, from a dose that you take by mouth. And, you take some by mouth, and it's gone in about 3 hours. Nitric oxide lasts 5 whole seconds. So you need something with it to give it a long-acting effect, and that's what citrulline can do. So, all right, I get arginine in my body. What's that going to do for me? Well, most importantly, it's going to give your blood vessels what it needs to make that nitric oxide. What does the nitric oxide do? It's going to help relax blood vessels over the short term and over the long term. Not only will it relax them on a daily basis, but it makes the blood vessels healthier, more supple. It's going to strengthen that cap over any plaque, and it's going to actually help the plaque melt away. So what does that mean for me, Doc? That means that your heart is going to have all its blood flow supported instead of the slow squeeze, which our modern lifestyle does. We're slowly squeezing off the blood flow to our heart and our brain. You're going to do the opposite effect. You're giving it what it needs. So people also report improvement in their muscle performance because guess what? Now you've got the blood flow supported there. People are working out. They go, I don't get it. I can work out so much longer. You're having all the waste products carried away and the oxygen's coming in. So that's a fantastic effect there. People are reporting being able to think better, being able to function better, walking better because guess what? You've got the blood flow. It's not hurting anymore. So all of these different processes in the body can benefit. Even we now know many of the things that we chalk up to just aging. You know, your doctor says, well, you're not young like you used to be. Your vision isn't as good. Macular degeneration is the number one cause of age-associated blindness. Guess what? People are having improvement in those situations in their eyes. And in every tissue of the body, people are seeing improvement because of this support of blood flow. So if you're improving the blood flow all over the body, people are, it's like they're coming alive, okay? They say, I don't understand. I've got all this energy now. I just cleaned the whole house and I didn't even think about it. I was just, usually I have to sit down. I'll do a room and I have to rest. Now I've got all this energy. Fatigue issues. Oh, I used to always have to take a nap in the afternoon. Now I'm ready to go. I'm ready for more. People tell me that they would go to functions Wednesday evening and they'd be falling asleep, you know, and now they're awake for the whole thing. And it's a very exciting thing when you realize people who have been just leaving things out of their life because it's too hard, it's too much work, I can't do it. It's not any fun anymore because it's more like work than like fun. They're getting their lives back. They're taking these activities on again, whether it's volunteering or, you know, singing in the choir or whatever. So that's an exciting situation when people get their lives back. Well, let's start with the concept that you're fine, you feel fine. So far as you can tell, everything's fine. The doctor checked your blood work and he says that your blood pressure is fine and your cholesterol number is fine. That's nice, good for you. I can assure you that atherosclerosis is already well established in your body, guaranteed. Remember, we know from autopsy results of soldiers, children, okay? We know that the atherosclerosis situation is already underway. Anything that you're doing to get your body healthier, you're adding nitric oxide to the system, you're helping make sure those blood vessels are relaxed, you're making sure that that cholesterol plaque is melting away. That's going to stand you in better stead this year, next year, in 5 years, in 20 years, and in 50 years if you've got that process underway right now so that you're reversing the damage that's already been done. So you need to not wait to know that you have a problem. By the time you've got a problem, first of all, a lot of damage has been done that you're going to have to take special measures to undo, and it all could have been prevented. If you are proactive in your approach to your health and you're getting the nitric oxide that your body needs to be as healthy as possible, that's going to stand you in better stead, not just this year, but next year, in 5 years, 10 years, 20 years, 50 years. So it's necessary to do things now before you know you have trouble. I do want to spend a second on the cholesterol. There's a lot of information about cholesterol. Very little of it suggests that by taking a drug and changing your cholesterol level that you will live a longer, healthier, happier life, okay? In fact, it's almost exactly the opposite. And it's not 100%, but there's enough data out there that should really make you question and really work with your doctor on, do I really need to be on that cholesterol medication? You have to understand that there are side effects. I believe that informed consent means you know the risks and benefits of doing what your doctor recommends, and you know the risks and benefits of not, and the probabilities of all of them. Because I think a lot of people would choose differently if they knew just how likely this problem was or wouldn't be. When you improve the blood circulation anywhere with something like a arginine, citrulline, it's going to improve everywhere. Now, remember, 90% of erectile dysfunction is a blood flow problem. So frequently people are saying, hey, I don't even need that pill anymore. And this is the way I think of it. Actually, I think medicine owes a debt of gratitude to Viagra, and this is why. Before Viagra, the only thing you could do, if you told your doctor, hey, I'm having trouble in that department, he could refer you to a urologic surgeon. Consequently, no one really complained of it, okay? It was just, nobody talked about it. When that little blue pill came out, or whatever color it is, when Viagra came out, though, there was suddenly something any doctor, any internist could write a prescription for, and it worked. Now, the good news is it worked in the short term. The bad news is it had some side effects, okay? People are more likely to have trouble with their heart, more likely to have trouble with their vision. There's some serious side effects that may be at work here. And then at the end of the day, that effect is gone. Now, Why do I think we owe a debt of gratitude to Viagra? Because before Viagra, nobody complained. Now we've got Viagra. People come out of the woodwork and say, hey, I'm having trouble in that department. If you've got trouble in the blood flow there, chances are you have trouble in the blood flow in your heart. It's the earliest marker for heart disease. Erectile dysfunction, I'll say it again, is the earliest marker for heart disease. And it's better than your cholesterol level. It's better than your blood pressure. It's a better marker than any of those other problems. So when we say, well, I could just take a pill for it, yes, but number one, you still have the problem. So when you're taking arginine, citrulline, you're actually making the body healthier. You're supporting the blood flow so that that's not going to be a problem anymore. And that's what people are telling us. They come back and say, I used to need that little pill, but not anymore. And that's wonderful.